Do you have gonorrhea and don't know the symptoms or even how to treat it? I'll explain it in this video. Before we start, we should know that gonorrhea is a sexually transmitted disease that can affect both men and women. And it can cause infections in the genitals, rectum, and throat. It depends on where you've had contact with the Neisseria gonorrhoeae bacteria. This is a common infection that occurs between the ages of 15 to 24. But something important to know is the symptoms that gonorrhea causes, as it's very different for men and women. And also the area where contact was made with the Neisseria gonorrhoeae bacteria. It's possible that some men may not show symptoms of gonorrhea, but there are cases where men do show symptoms of gonorrhea, such as a burning sensation when urinating, a white discharge that changes to yellowish to greenish, similar to the pus that comes out of the penis. There can also be pain or inflammation in the testicles, which is very uncommon, but it can happen. Most women sometimes do not show symptoms, and if they do, they give very few symptoms, which can even be confusing. They are usually mild and can cause pain or a burning sensation when urinating. Increase in vaginal discharge. Vaginal bleeding between periods can also occur. Among other symptoms, as we had discussed, is gonorrhea. Symptoms can also occur in other parts of our body where we had contact, and one of those parts is the anal area. One of those symptoms can present anal discharge, anal itching, pains, bleeding, and pain when defecating or evacuating. But you may ask, how is gonorrhea transmitted, or how did you acquire this disease? Well, gonorrhea can be contracted by having anal, vaginal, and oral sex, of course, with a person who has the disease. A pregnant woman who has gonorrhea can transmit it to her baby during childbirth. Anyone who has unprotected sex with a person who has gonorrhea is prone to contracting gonorrhea. If you are a sexually active man or woman, it is recommended that you get tested for gonorrhea annually. As I mentioned earlier, sometimes there are no symptoms, and this disease can go unnoticed. A pregnant woman should notify her doctor who is monitoring her pregnancy so that she can receive treatment, and thus avoid complications during pregnancy and, above all, serious health problems for her baby. How is gonorrhea diagnosed? In some cases, a urine sample can determine if a person has gonorrhea. Some countries opt for taking samples of vaginal discharge, urethral discharge, anal discharge, or throat discharge. And this, obviously, because it gives a better result. And also, what is the recommended treatment for treating gonorrhea? As I had mentioned earlier, you can contract Neisseria gonorrhea through oral or anal sex. And we should take the sample from where the contact with the Neisseria gonorrhea bacteria occurred. But many people must wonder or worry, is gonorrhea curable? And let me tell you that it is curable with the right treatment. It's important that the person takes the right medication and follows everything their doctor has ordered. Although it has been increasingly difficult to treat gonorrhea as the strain of gonorrhea has become resistant to drugs. That's why it's important that if you have gonorrhea or suspect you've been in contact, you go to the doctor and don't self-medicate. And another important question, how many days can I have sex again? Well, the person who is under treatment, who started the treatment for gonorrhea, should wait at least 7 days, obviously, after having completely finished their treatment. This way, to avoid getting infected with gonorrhea again. Or that they could transmit it to their sexual partner or sexual partners. And even if your partner has the disease, they should also undergo treatment. But what happens if a person does not receive treatment for gonorrhea? When a person does not get treated for gonorrhea, it can cause them permanent health problems in both men and women. In women, it can cause pelvic inflammatory disease, scar tissue formation that can block the fallopian tubes, leading to ectopic pregnancies, infertility, pelvic pain, or chronic abdominal pain. In men, it can cause pain in the testicular ducts. In rare cases, it can cause infertility in men. Therefore, don't forget that if you are sexually active, you should get your routine checks for sexually transmitted diseases. And don't forget to always go to your doctor so he can assist you. Dr. David Campos reports,